So guys, today the topic of our discussion is pharmacist's role in drug information and medication management. To properly understand this topic, we have to go through few terms. So let's take a start. So first of all, we will start with who is pharmacist. Pharmacist एक ऐसा पर्सन होता है जिसके पास complete and comprehensive knowledge होता है about the drug, like how is it manufactured, how it goes into our bodies, how it acts in the body, how is it absorbed, how is it metabolized, and how is it excreted, and also the drug adverse effects it causes or the side effects. So pharmacist is person having a complete information about the drug. So if we define the term pharmacist means a person licensed by a state to practice pharmacy, including the dispensing and selling of prescription drugs. Pharmacist को हम ड्रगिस्ट या केमिस्ट भी कहते हैं. Pharmacist तमाम जो मेडिसिन रिलेटेड फील्ड होती हैं उसके साथ डील करता है. ड्रग इंफॉर्मेशन. अब ड्रग इंफॉर्मेशन क्या है? ड्रग इंफॉर्मेशन इज द करंट रेलेवेंट क्रिटिकल एग्जामिन डाटा अबाउट ड्रग एंड ड्रग यूज फॉर गिवन पेशेंट और सिचुएशन. सबसे पहले जो फर्स्ट ड्रग इंफॉर्मेशन सेंटर जो इस्टेब्लिश किया गया था वो यूनिवर्सिटी ऑफ केंटकी में इन 1960 में इस्टेब्लिश किया गया था. सो अगर हम बात करेंगे ड्रग इंफॉर्मेशन रिसोर्सेज कौन कौन से हैं जिनसे हम ऑथेंटिक इंफॉर्मेशन अबाउट द ड्रग ले सकते हैं, तो उनको हम फर्दर क्लासिफाई करते हैं तीन सोर्सेज में: प्राइमरी सोर्सेज, सेकेंडरी सोर्सेज एंड टर्शियरी सोर्सेज. प्राइमरी सोर्सेज में हमारे पास जर्नल्स आ जाते हैं, आर्टिकल्स आ जाते हैं, लाइक हमारे पास जो मोस्ट पॉपुलर जर्नल फार्मेसी जर्नल. सेकेंडरी सोर्सेज में हमारे पास एब्स्ट्रैक्टिंग आ जाते हैं जो फर्दर हमें लीड करते हैं टुवर्ड्स द मेन आर्टिकल्स और रिसर्च आर्टिकल्स. थर्ड हमारे पास आ जाते हैं टर्शियरी सोर्सेज, लाइक हमारे पास जो टेक्स्ट बुक हैं, फॉर एग्जांपल लिपिनकॉट, कैटजंग, ऑल these books are tertiary sources. So now the question arises, why there is need of drug information? So as we can see, a large number of drugs are increases in the market, drug literature is increasing continuously, and there is a patient awareness. Whenever the patient goes to the pharmacy or want to take some medicines, he asks about the information about the drug. So pharmacists must have complete information about the drug. Fourth one is to improve quality of patient care, to improve patient outcomes, to ensure the prudent use of resources. So what are the activities or drug information activities performed by the pharmacist? First one is providing drug information. Anyone who needs information can obtain from the pharmacist. So secondly, pharmacists provide online and print information resources. Third, he interact with other healthcare professionals and educate them or provide the drug information. Educating pharmacy students and residents like newly internees who are going to practice in the pharmacy, pharmacists can educate them. Contributing to literature research and providing peer review to research. So what are the steps to respond to drug information requests? Anyone who wants to obtain information about the drug, so what are the steps? First of all, to identify the requester, obtain the background information. So third, categorize the question, in which category the question falls, conduct research, analyze the information, and then finally the information which is obtained, disseminate that information to the requester, and last one is the follow-up and the documentation. Drug Information Center. The Pan American Health Organization defines Drug Information Center as operational units that provide technical, scientific information about drugs in an objective and timely manner. These drug information centers provide unbiased information, and pharmacy is one of the most important and integral member of the drug information center. So now we are leading towards our main topic, what is medication management. Medication management is the clinical, cost-effective and safe use of medicines to ensure patients gets the maximum benefit from the medicines they need, while at the same time minimizing potential harm. This is the term defined by the UK's Medicine and Healthcare Products Regulatory Agency, MHRA. So, what's the role of pharmacists in medication management? First of all, pharmacist has to review all of the medications which are prescribed by the prescribers, then providing care to the patient, identify and address the medication problems. So what are the problems? So these problems may include medications that are not being used correctly, duplication of medications, unnecessary medications. Here not being used correctly means like if the patient is not taking the medicine at the given time, or duplication of medication, the prescriber has prescribed the medicines or the two different brands containing the same ingredient. Unnecessary medication like where there is no need of prescribing medicines, or there is no indication for prescribing the medication. In-depth medication related education, consultation and advice provided to patients, family or caregiver. And last one is the collaboration with the patient, physician and other healthcare providers to achieve optimal goals. This is the most important role in medication management of pharmacists, to collaborate with the patient, physician and other healthcare, because nowadays polypharmacy is very common. So like if a patient goes to one prescriber and then to another prescriber and start taking the medications of two different prescribers, there may be a chances of drug interactions. So pharmacists will review the medications that are prescribed by different prescribers and will collaborate with the patient's physicians or other healthcare providers, so the patient may get the right medication. So medication, what is the medication management process? So it contains different steps, like first one is the selection of medication, then prescribing of medication, procurement and storage of medication, preparation and dispensing, administering, and last one is the monitoring and follow up selection. So what's there in selection? So in some countries सिलेक्शन जो है वो कंफ्यूज किया जा सकता है प्रेस्क्राइबिंग के साथ. So that's why joint communication defines selection as the appropriate choice of medication for a specific indication, to mean have appropriate medicine for appropriate indication. So in the selection process, three different steps are: first is the identification of drug patient interaction. Second is the drug disease interaction, like in some patient there might be kidney disease, lung disease or liver disease, so what will be the effect of drug on that disease. And last one is the drug interaction, as I have also already explained, polypharmacy, so there may be chances of drug interaction. So we have to consider all three steps before the selection of drug. So next is the prescribing, dosing and transcribing. What is meant by prescribe? To prescribe is to authorize, by means of written prescription, the supply of medicines. Pharmacist is the main or most important person who plays a key role in the complexity of prescribing and prescribing, like especially in conditions like chemotherapy regimens, to influence the prescribing of other health professionals, influences prescribing by acting as information resources about the medications. So what are the steps of prescribing? First of all, assess, then to determine, prescribe and document. Assess the patient to select the medication, then to determine the correct regimen and prescribe the medication, and last one is the documentation in medication record. So what is dosing? So prescriber have to take a look whether it is an elderly patient or pediatric patient, and considering unique factors, he or she has to prescribe accordingly. What is transcribing? Basically, transcribing is the process by which a prescriber's written order is copied either manually or electronically entered into the pharmacy records. So there may be chances if a manual transcribing process is adopted, there are more chances of error. So one of the pharmacist's role here is to provide solution to minimize these errors. Now